We've been together over 40, so you've got a ways to go.
Good morning, it's 9:10. We appreciate you watching Minnesota Live. There is a group up in Duluth that's working to address what many are calling a mental health crisis. It is called the Miller-Dwan Foundation, and they're using a program created by the World Health Organization.
It aims to train people like you and me on how to help others dealing with common challenges like stress, anxiety, depression. Rick Gertzema is a licensed psychologist. He's here to tell us a little bit more about it. Welcome, Rick.
Thank you.
Nice
It's
to have you
wonderful
with
to be
us.
here.
Likewise.
Thank you for inviting me.
So tell us a little bit about the Miller-Dwan Foundation.
So the Miller-Dwan Foundation is a smaller foundation in Duluth, and what we wanted to do, we started 3 years ago. We wanted to be a part of solving what we call the mental health crisis. The mental health crisis has been alive and well pre-pandemic. What we know is that the pandemic just exacerbated and sort of blew the roof off of stress, anxiety, people struggling. And with all the other stressors happening in the world, we started Archimind, which is a global mental health institute for mental health solutions, and we are adapting World Health Organization interventions and bringing them into the United States.
We just had a stat up on the screen a second ago that showed that the average of people with depression is higher in Duluth than it is nationally. What do you think is behind that?
I don't know that it's necessarily totally accurate. I think what that really reflects is, I think that when you're in a community that really is talking about depression, and of course, more isolation, more rural, and I think when you look at urban versus rural, of course, there's going to be some differences.
Okay.
So what are these strategies that you are teaching? What are these strategies you're kind of adopting through the World Health Organization?
So what is happening with, it's a program called Problem Management Plus, which is one of our programs. And Problem Management Plus is teaching people, it came into the United States via New York. We're partnering with the New School for Social Research, and they were the first site in the United States to bring Problem Management Plus, which is alive and well in 20 other countries across the globe. They're not alive and well in the United States. So New York City was first. We partnered with the New School and George Washington University, and we did a pilot study in the Twin Ports, Duluth, Superior, for these interventions. And it's teaching people like the two of you how, number one, how can you manage your stress? Because we're not going to solve your stress. We can teach you ways to manage your stress. And that really is teaching what's adversity, what adversity are you facing, low to moderate stress, and then we teach mindful breathing. Because if we can do breathing, huge first step. Secondly is managing problems. And managing problems is list every single problem you can possibly think of in your world. People say, you better give me 2 pieces of paper. What ends up happening really, 7 or 8 problems. And what's really liberating about managing problems is that we want you to take, now look at that list. If it's not under your control and you can't do anything about that problem, get it off your list because you can't do anything about it anyway. And then we do brainstorming, come up with action plans. Third strategy, get going, keep doing. Because as human beings, we say, as soon as I feel better, I'll go to the gym. As soon as I have more time, I'll do that. And what we know as humans, we have to get out of the inactivity and get active. So we ask people, find one thing that brings you joy. Some small thing. Might be going on a walk, might be calling a friend, might be texting a friend. What's going to bring you some joy? Create that action plan again. And then the fourth strategy, strengthening social supports. Because when we think about our social supports, it's usually a pretty small circle.
People,
yeah. And so what we want people to do is think big, think bigger, think outside that. Who else can you reach out to? Maybe a neighbor, maybe somebody down the street. Because when we're all feeling low to moderate stress, we tend to pull back. It'll all be okay. It's that inactivity, and let's reach out. Let's strengthen what the social supports look like. And then the fifth strategy is staying well. So what's your plan? How are you going to use these skills? All of this care is delivered by lay professionals, non-specialists, because we know we will never hire enough therapists. There aren't enough professional people around. I'm a licensed psychologist. I know full well. I've been in mental health for over 40 years. It's the only work I've done. And I think this is the way that we're going to create a brand new workforce and reach people before it gets to that level of, I'm really in some trouble. This is a crisis. Because if we can get upstream, truly upstream, we can change the way that care is delivered.
Well, these things all feel very approachable versus, booking an appointment, sitting, like these things feel very actionable. And I guess people worried about spending money on therapy, any of the things that hold people back.
Exactly right, because all of the barriers are taken away. So we've trained, in the last year, we've trained over 100 people, not only locally, but we've trained on the East Coast, we've trained on the West Coast. We've trained with the International Rescue Committee in Atlanta, Georgia, for refugees. We've been in the indigenous community. So the faith communities. What we want to do is train people within communities so that when I say, I'm really kind of struggling here, I can go to somebody that I already know. I don't have to drive someplace. I don't have to worry about co-pays. And when you think about, and as we've been watching politically what's been happening in the world, thinking about how do we use those strategies to deal with that low to moderate stress in the adversity that each one of us might be facing.
So Rick, are you looking for more people to train?
Our goal, frankly, we've started in the Twin Ports. Our goal is we want this to become the national model. We're not thinking small, because I really do believe, after all the decades of work that I've done, it will work anywhere. It's working in 20 other countries across the globe. Second city in the United States, and it's right here in Minnesota. So if we can continue to create what is in the Twin Ports today, we could expand that regionally, statewide. Minnesota could become the state that really is holding the standard, and then we can train across the globe.
Well, I think it's really telling that you've already trained 100 people, because I do think that people want to help others. I think we recognize as a society that people are struggling. Maybe going back to school and getting a therapy degree is not in your cards.
Exactly.
But getting this training, which is what, 5 sessions for an hour and a half, something like that?
Exactly. And the other thing that we've learned is that for our pilot project, we did a baseline survey, and then we did a survey at 5 weeks, and then we did a survey at 20 weeks for follow-up. We saw a 67% decrease in anxiety from session 1 to session 5. We saw a 50% decrease in depression from the baseline to week 5. And there's a self-rating scale that clients or the people that we're working with, the recipients of PM+, and what we found is that they steadily are saying, those problems don't affect me quite as much. And we're seeing the same results at 20 weeks, which is very parallel to all the work that's being done in New York City at the New School with a project called Recoup New York, which is also consistent with what's happening globally in these other countries across the globe.
Clearly it's working.
It's just like, I think we have it.
Rick, thanks for stopping by. And I know you guys are going to be very interested in learning more information about this program and the Miller Dwan Foundation. Just head to minnesotalive.com. And if you or someone you know is struggling, please know help is available. You can call or text 988 for immediate help.